Hi, I'm Dr. Rasya Dixit from Dr. Dixit Clinics, Bangalore. I'm a dermatologist. The face is the most sun-exposed part of the human body, and in the face, the most anteriorly projected part, which is the nose, gets its fair share of sun. So when we talk about pigmentation which affects this nose, we are talking about two major causes. One is definitely a melasma, which is a hormonal pigmentation. It can be seen as well as in men as well as women. In men, this pigmentation tends to be very resistant because men don't like to use sunscreen and they are the people who are always in the sun. So when we choose sunscreen for men and when we have to treat melasma, we have to avoid the sun as well as highly intense visible radiation which could come from your computer or in your office space. So you need to use a broad spectrum sunblock which has a minimum SPF of 40 and which has a UVA cover and maybe even an infrared cover if you're working with inside light or with heat. The second thing which you need to worry about when you have pigmentation on the nose is there a hormonal component to it. Then if you have a genetic component to it, you may have to seek the help of a dermatologist who could tell you which kind of retinol creams or skin lightening creams you could use. Please beware that there are many skin lightening creams which are available over the counter in markets which contain steroids. So make sure you're speaking to your dermatologist to avoid these kind of complications, and then use a cream continuously. So your sunscreen as a regular in the mornings and in the afternoons, and your skin lightening creams which may be vitamin A and other non-hydroquinol or hydroquinol containing skin lightening creams at night. The other thing that we do see in men is freckling, which is just a pigmentation which is only in small dots, which is again because of sun exposure. This needs to be lasered off. And we also see recently something called chick sign, which is after any viral fever, patients developing a sudden pigmentation on the nose, and this is known as chick sign and it can be reflective of chikungunya. This resolves without treatment. So for you to find out which one problem that you may be having, speak to a dermatologist. They will be able to guide you in the appropriate direction.